Go ahead and cover the topic of STIs and STDs for your Medsurg Adult Health Nursing course and for the NCLEX. Now, in this video, we're not going to cover HIV, which is a big part of the topic of STDs because we have a separate video on that. The rest of the topic of STIs and STDs is not a very heavy NCLEX item, so we're going to go through this and really just cover all the key main points for your Medsurg course to get you covered with everything you need to know. So let's go through the background of transmission. STIs or STDs are sexually transmitted infections. That means vaginal sex, anal sex, or oral sex. Now, STIs and STDs can also be transmitted during vaginal delivery. Not all of them, but some of them. For this reason, patients that have certain STIs may be recommended to deliver via cesarean route as opposed to vaginal, which would transmit the infection to the baby. HPV and HSV are two viruses, two STIs that are transmitted by skin-to-skin contact. Now, the fluids of an infected patient can be contagious for STDs. And finally, keep in mind with STDs that a lot of these are reportable that you have to notify the local health department. Let's jump right to it. HSV, herpes simplex virus 1 and 2, is a viral infection. The classic sign or symptom of this is going to be a painful vesicle or painful lesion, depending which terminology the test is going to use, but a painful vesicle lesion that's going to point you right towards herpes. We're going to talk in a few minutes about syphilis, which is painless. The treatment for herpes is going to be an antiviral medication such as acyclovir or valcyclovir. Herpes, very infamously, has no cure. Once a patient has it, they have it for life. Hopefully, most of the time, they're not symptomatic, but on occasion, they will get what we call eruptions, where these painful vesicles or lesions do erupt to the surface. Now, patient education is they must get treatment within 72 hours. If they don't start the acyclovir or valcyclovir within 72 hours, the medication is not going to work. And how do we test for HSV? It's by a lesion swab test. Next, let's look at HPV, human papillomavirus. First of all, the most common test question on this is one of the leading causes of cervical cancer. So definitely know that. But let's get to it. This is a viral infection known as genital warts. This is diagnosed by observing the genital warts, and we can also do part of the diagnostics on a pap smear. The treatment for this is wart removal, and the big teaching point for this is that patients must be recommended to get the HPV vaccine. Next, let's look at gonorrhea and chlamydia. These are both bacterial infections, and these very often go together. So for studying purposes, remember gonorrhea and chlamydia go together to the point that if a patient is being treated for one of them, unless they tested negative for the other one, the standard is that we treat the patient for both. So let's start with gonorrhea. Gonorrhea is a bacterial infection. The presentation is a thick, purulent, pussy discharge, usually a yellowish greenish that the patient has, and that is going to be the classic presentation of gonorrhea. They may also have dysuria, which is pain while urinating. The treatment for this is ceftriaxone, which is an IV antibiotic. We already said that this often goes with chlamydia, so you have to look at the two together. Untreated gonorrhea can lead to PID, pelvic inflammatory disease. I didn't do a whole separate thing on PID, but PID or pelvic inflammatory disease is a complication that can come from both chlamydia and gonorrhea. The big thing that we get tested on with pelvic inflammatory disease is the fact that the assessment for it is that the patient will have cervical motion tenderness or adnexal tenderness. So if you see that on a test, cervical tenderness or adnexal tenderness, they're pointing you towards PID, pelvic inflammatory disease. Again, that arises from not treating gonorrhea or chlamydia. Now, in males, gonorrhea, if left untreated, can lead to epididymitis. The test for gonorrhea is going to be the NAAT test or the NAT test. Now let's move on to chlamydia. Chlamydia is the other bacterial infection. This is the most common STD in the United States. And again, this often goes together with gonorrhea. The presentation for this is also going to be a discharge, but it's going to be more of a thinner, maybe a whiter, milkier looking discharge. Chlamydia, however, is mostly asymptomatic, and that's a common test question, is that it's going to be mostly asymptomatic. The treatment for chlamydia is going to be azithromycin or doxycycline, and again, the same test is going to be the NAAT. Next, let's look at syphilis. Syphilis is another bacterial infection, and this one goes through three phases. And this is a common test question. There's primary syphilis, secondary syphilis, and tertiary syphilis. Primary syphilis, the classic presentation, what I see on all the test questions, is about this painless chancre, painless lesion that presents on the genitals. And that's essentially where the syphilis is. That's going to be primary syphilis. Secondary syphilis is going to present with flu-like symptoms, and they'll have a rash possibly on the palms of the hands and the soles of the feet. That's going to be secondary syphilis. And then finally, tertiary syphilis is where you're going to have neurological or cardiac effects. So that's going to be primary, secondary, and tertiary syphilis. You do need to know that. And then the treatment for this is going to be penicillin G. This is a IM, an injection penicillin. Penicillin G is how we treat it. And finally, the lab test for syphilis is going to be RPR. The last one we're going to look at is trichomoniasis. This is a protozoal infection. And this one is mostly asymptomatic in men. And in women, it presents with discharge. And this would be a really frothy discharge. This would be a foul smelling discharge. And this would also have that dysuria, that pain while urinating. The treatment for this is an antiprotozoal drug called metronidazole. And the test for this is also going to be the NAAT test. Now, we did not cover HIV in this video, so make sure you go and study that. But let's quickly wrap up by looking at client education. For patients in regards to STDs, the things you'll get tested on is that patients should be educated about safe sex, which means using condoms 100% of the time. That means even if their partner, even if they're taking PrEP or things like that, they still need to be using condoms. They should be educated to always complete the full course of antibiotics that they've been prescribed. They must notify any potential partner that they have been infected with an STD to get them treatment. Nowadays in the US, it's very easy to get treatment for STDs, especially if you have an infected partner. We have guidelines that we just basically give the prescription very quickly. And then patients also need to be educated to avoid sex for 7 days after concluding treatment. Hopefully this covers whatever you need to know about STIs and STDs for your Medsurg nursing course and for the NCLEX. Do keep in mind, we did not discuss yeast infections. We did not discuss bacterial vaginosis because those are not STDs, but they may be taught together with this in your nursing school, in which case, please go ahead and study that as well. If you have any questions, please reach out. Have a great rest of the day.